Okay. Welcome to Community Check-in Friday. Marhaban bikum jami'an. We're very happy to have you with us, joining us today. We're very excited to have Dr. Sana Obaid with us to talk to us about what it means to have coronavirus while pregnant, and is there an extra threat to pregnant women. And I want to remind you all that this is part of a series that PAC is doing. At this time, we have Palestine Mondays, How To Tuesdays, Workshop Wednesdays, Game Night Thursdays, and then Community Check-in Fridays and Serene Saturdays. And we're very excited and happy to be bringing this to you. Please make sure to visit us at the website, which is listed below, www.paccusa.org, to talk about, to get any more information about any of our programming. So without further ado, I'd like to introduce our guest of honor, Dr. Sana Obaid, who is a member of the American Board of Obstetrics and Gynecology and a fellow of the American College of Obstetrics and Gynecology. She's also the president of the Arab American Association, the New Jersey chapter. We're the National Arab American Association of the New Jersey chapter. We're very happy and excited to have you with us today. And please.
Thank you, Rania, and I thank PAC for all what they're doing for community. They always rise to occasion.
Thank you very much. So we're going to start with the first question today, which is, do pregnant women face a greater risk from coronavirus?
Pregnant women, like any other population, she has risk, but not greater than other population. The only thing that they might have more complications as their immunity little less than normal people. And we're dealing with mother and baby.
Thank you very much. The next question is the medication used to treat the coronavirus, is it safe during pregnancy?
It's all trials. So far, they consider hydroxychloroquine safe to use in pregnancy because it has been used for a long time. And so far, all the trials and studies did not show any harm to the mother and baby. And the treatment for COVID-19 in pregnancy, it depends. So far, most of our pregnants, they're divided into 3 groups. The first group that have COVID-19, minimal symptoms, we treat at home with fluids and Tylenol. Moderate symptoms, but no shortness of breath, we treat at home also with hydroxychloroquine, Zithromax, and Tylenol. Severe cases, we admit to the hospital. Hydroxychloroquine being used in the hospitals with good effects for pregnants. Recent few days ago, we start using Remdesivir, which is a new drug. We don't know anything about it, whether it's safe or not. I want you to know that this COVID-19 is a rapidly changing subject, that we know things as it goes.
Thank you very much. I think that's what's important, is that this is a rapidly changing environment and something that's constantly changing, but we're glad to know that this is safe. So please make sure to take care of yourself. I'm going to be asking questions throughout this session. However, if any of the audience members have questions, please feel free to leave them in the comments. We'll get to them towards the end of our session together. So the next question is, does having coronavirus create a greater chance of having a miscarriage or preterm labor?
For miscarriage is not really known, but preterm labor can happen as if the pregnant in 3rd trimester, which is 7-8 months, affected with the virus with high fever, it can cause preterm labor.
Okay, thank you very much. Which means that we need to, pregnant women definitely need to make sure they're being careful. How are prenatal checkups changing as the reality of COVID is changing?
First of all, pregnants, they don't follow the same as other population. They have to follow up in prenatal offices and obstetrics, their provider office. Usually the offices now are taking precautions. There's no crowd, no waiting, and she has to go with mask, and all the healthcare professionals there wearing masks. Pregnant woman has to follow because we don't want to have problems happen with the babies because we're dealing with both mother and the baby.
Thank you very much. So my next question is, can a mother with coronavirus pass the virus to the baby in the womb?
All the trials and studies showed that it does not go to the babies and the uterus. It's not like HIV. There's no vertical transmission to the baby. And all the tests were done on newborns in China and Colombia showed that the virus does not pass to the baby. But some babies get the virus infected from the mother if we don't know the mother is affected. And that's why now this is a new trend in New Jersey hospitals. I talk about the hospital I affiliate with, St. Joseph, that do COVID-19 test for all patients going into labor. So we know that the patient has COVID. So medical staff will take precautions, and we do precautions for the baby. And another thing, good thing for pregnant to hear that there was one study just came yesterday from Colombia, as they see a lot of pregnant patients. 214 pregnant went into labor. They tested for COVID-19, and 80% of those were who were positive. 80% have no symptoms. That's good for pregnants to hear that, because it seems that even if they got it, sometimes they don't have symptoms.
That's good to know. So just to summarize, a mother cannot pass on the disease to her, the corona to her child if she's pregnant with the baby in the womb, but she can potentially pass it after delivery if she is infected with the virus.
Yes.
Correct? Okay. So, I've heard from some people that there are different restrictions in the delivery room now. I've heard maybe fathers are not allowed or visitors are not allowed. Can you talk a little bit about how delivery and after the delivery is changing in the hospitals because of coronavirus?
Okay. Now the new trend with coronavirus and COVID-19 infection, usually there was 2 or 3 in labor and delivery. Now only the husband, they have to check in. They give them face mask to go into the labor and delivery, and all the staff wearing face mask. Things changed because everything changed with COVID-19. Nothing stayed the same. And it's going to be for some time. We're having a new life after COVID-19. And I want to say something that in labor and delivery, the same as we usually do. For patient who is infected with COVID-19, she can have epidural, has no problem with that, but it's not recommended that she has nitrous oxide inhaler or IV medications for pain. That affects respiration for patients who is infected with COVID-19.
So just because I have heard, so husbands are allowed in the delivery room.
Yes.
The mothers.
Yes.
It's just limited guests. Otherwise, like no one else is allowed in.
Yes.
Okay. Thank you very much for that. Now, if someone does have COVID, are they at a greater risk of having a C-section?
No. COVID-19 is not indication for cesarean. Cesarean section, the indication for cesarean only if something happened to the baby or the mother in labor. It's not COVID-19 by itself is not indication. She can deliver normal, no problem.
Okay, so that means hopefully, as long as there's no other, further complications, the baby would be delivered as it would be without COVID-19.
Yes.
Okay. And then again, going back to the fact of how the hospitals are changing, how long does a person who delivered in the hospital have to stay in the hospital after birth? And are visitors allowed?
First, normal delivery usually stays 2 days. Now only 1 day, 24 hours. If of course, if everything is good. 2 days after cesarean section, we decrease the stay in the hospital because decrease the time for them to get infected, or we need beds in the hospitals at this time. For visitors, no visitors allowed. Only her husband, and he should not go in and out. They give him a face mask and stay in the room with her.
So just to elaborate on that last part, because I heard that people, like if the husband stays with the mom, they both have to stay together until they both leave. Because if he gets out, he may not be able to come back in. Is that true?
Yes, yes.
Okay. So would you recommend a home birth? Is that safer than going to the hospital right now?
Of course not. Home birth is not safe. Maybe a long time ago they were doing it, but as we we having all these complications in labor and delivery, we have mother and we have baby. I don't recommend home delivery just to avoid COVID-19. We do our precautions. The patient does her precaution. She comes with mask, all the medical staff having masks, and we do all the precautions, because also precautions for us who deliver them. So we do all the precautions so nobody get infected.
That's good to know. That's definitely very reassuring. So if I or anybody that's pregnant has COVID-19, can they breastfeed their baby when they give birth to the baby?
Um, COVID-19 does not go to the breast milk. That's for sure. And all the studies showed that. She can breastfeed her baby if she's past 14 days of the infection. If she delivered and she has the infection recent or just before she delivered, we separate the baby from the mother, and she wear mask when she breast pump, do breast pumping, take the milk out, and somebody feed the baby for at least 14 days is better. So when after 14 days, she can join her baby and breastfeed him.
So because I currently breastfeed my daughter, so I'm curious. So if I, God forbid, get coronavirus, I will not be able to breastfeed my child during that time.
You can put a mask and use a breast pump, take the milk and give it, somebody will breastfeed her.
Okay.
Because you don't want to infect your daughter. That's the point.
And you don't, the infection doesn't pass through the milk, it just passes through close proximity, correct?
Yes, yes.
Okay. And so I wanted to talk a little bit more about masks right now, since we started talking about the topic. Do you think that masks are necessary, and what kind of masks are necessary for just any normal person who's not infected?
I believe mask is necessary at this time because we have so many people who have no symptoms and carry the virus. And you should be, even if you're wearing mask, you should be at least 6 feet. Even now, studies showed the virus can travel more than 6 feet. 6 feet. So mask is important. You should put mask when you are in public, but not necessarily N95. We should keep this for healthcare professionals who need it, and we have shortage everywhere in this kind of mask. They can wear surgical mask or even scarf. They can put it 2 layers on their face, even better than surgical mask.
Okay. And I want to ask you, in your professional opinion, how much longer do you think this coronavirus reality is going to last?
Nobody knows, Rania. It seems we're gonna get used to this kind of life. Our life changed. Is not after Corona. Is not like before Corona. We don't know. Nobody knows how long. Some people they say, "Oh, it's gonna go in waves, goes and then come back, and we're gonna have to be social distancing. We shouldn't still. We should be not shaking hands, all social distancing, not having big groups." it's like our life has changed.
Yeah, absolutely. If anyone has any questions from the audience now, we can definitely take it. So please make sure to put it in the comments. We will be reading them out loud now. And so my last question is, do you have any final messages for a pregnant mom, like that's worried and stressed out about about potentially getting corona or delivering with corona? Do you have any final advice for them?
For pregnant, just to stay home. That's the first message I give. Stay home. Don't go anywhere except when you need to go. And also not her only. Her husband can keep going in and out and getting for her the infection. So social distancing is important. Staying home is important. Take your vitamins. Prenatal vitamins has everything. Take extra vitamin C. Drink a lot of fluids. You can take also vitamin D. Most of the pregnants taking vitamin D anyway. And God save all of us.
Amen. Amen to that. So one of the questions we have is if we can get a ترجمة بالعربي. So I know there's Dr. Sana Obaid did an amazing interview with Hotline TV that we're going to be sharing on our page that goes into depth with everything that we just discussed during our time together. But I don't know إذا دكتور سنة يمكن like a ملخص لكل شيء حكيناه بالعربي بس للناس اللي عم بتفرجوا هلا.
Okay. كورونا COVID-19 اسمه COVID-19 عشان it's novel, it's a new virus اكتشفوه في ديسمبر 2019. It's pandemic everywhere, سريع الانتشار, قاتل, virus like that's why all the world is locked down. الحامل زيها زي أي الناس التانيين معرضة إنها تنصاب بالفيروس، بس لحتى الآن الحمد لله لأنه الحوامل فئة صغار السن واللي ما عندهم أمراض العدوى تبعتهم ما كانت كثيرة. لحتى الآن ما في maternal mortality، يعني ما في واحدة ماتت. في دراسة في الصين عملوا 100 حامل أصيبت بالفيروس، ما في واحدة فيهم ماتت. هذا يعني أخبار منيحة. بعدين في منهم مجموعة كبيرة أخذوا الفيروس وما ظهرت عليهم أعراض. الفيروس ما بينتقل للجنين في بطنها، الفيروس ما بينتقل للحليب، ممكن ترضع البيبي بس عن بعد. الولادة بالطبيعي إذا كل شيء طبيعي، قيصرية إلا إذا التزم الأمر لأمور خاصة بالبيبي أو الجنين أو الأم، مش لأنها مصابة بالفيروس. العلاج اللي بنستخدمه حالياً لعلاج الفيروس في الناس العاديين ممكن استخدامه للحوامل هيدروكسيكلوروكوين، زيثروماكس، تايلينول، والدراسات لحتى الآن ما أثبتت إنه خطير على الجنين. ودائما the best treatment، يعني أحسن علاج للحامل في عصر الكورونا إنها ما تنصاب فيه. Protection is the best treatment so far. So stay home، اجلسوا في البيت، تباعد اجتماعي، ما في سلام، ما في جمعات، كل شيء عن بعد. وهي السوشيال ميديا بتقرب كل الناس من بعض. حياتنا قبل الكورونا مش حتكون زي حياتنا بعد الكورونا.
يا أكيد. شكرا كثير للترجمة، وإياد حالها كمان بشكرك للترجمة. فشكرا كثير. في أجانا السؤال. There's a question that we got that says, do you agree if pregnant women go out of the hospital same day after delivery?
Same day, I don't recommend that, because even if I discharge her, if everything is good, I have the same question every day. I face it. Everything good with the mother, no problem, no bleeding. She did so good. I could discharge her, but the pediatrician does not send the baby home before 24 hours because they have to do test for the baby. That's the problem I'm facing. But it's better 24 hours for anyway.
Yeah, it's better to be safe than sorry. Ela Ajbara gives you a shout out and says, my favorite doctor. So thank you, Ela, for tuning in. And does anyone else have any questions before we wrap up? I think Dr. Sana Obaid did an amazing job summarizing the importance of what to do with a pregnant woman. I think the main thing is that, luckily we've gotten to the point, it's not as bad as we've expected for pregnant women, but we do need to be careful because they are at-risk populations. So we need to make sure that they are staying home, staying safe, and taking their precautions. And again, I think the most risk is just that when, if you get it, you won't be able to be there with your child, which at that point, the baby, all they want is their mother. So please, everybody, be careful, be safe, stay home. And I think Dr. Sana Obaid is got it exactly on point, which is the best medicine for coronavirus is do not get it. That is the best way to avoid it. And with that, I think we don't have any more questions. We have another shukran, Dr. Al-Malumat Al-Qayyima from Iyad Hadha and Lido Azam. Thanks you very much for answering the question. And I want to remind everybody that this is our community check-in. We do this every Friday at 5 p.m. Thank you so much, Dr. Sana Obaid, for joining us. We have a very, very busy schedule, and we really appreciate you taking the time to answer our questions and help address the concerns of our community. And we hope you all stay safe and stay well. And we will see you guys next Friday. Thank you very much.
Thank you, Rania. Thank you. Bye-bye.